I found that over the past weeks that I've needed this moment in the morning just to be quiet and to think about what's happening. You know, you take a little moment like, oh, it's okay to cry right now because, you know, my kids aren't going to see me and be upset, but also my colleagues aren't going to see me because I feel like I have to be strong at work too, for them and for me. So it's nice to be home and to be a little bit vulnerable sometimes, and that's okay because, you know, I think everybody has lived through a lot. You always know in the back of your mind something terrible could happen. A terrible event that you might be involved in as a healthcare professional, I think that looms in our minds, we know that. And yet, everything that's happened has been sort of surreal. Even though we knew that COVID was in other parts of the world, I don't know that we really understood how overwhelming this was going to be. As emergency nurses, we are on the front line. We care for patients struggling with opioid abuse. We care for victims of gun violence. And I don't know that a society really understands what we're seeing, what we're experiencing. But I think if people did, then perhaps much more attention would be paid to these huge dilemmas that our society is facing. When we first started encountering patients who were having COVID-like symptoms, you know, we did our best to get them into the department. We were trying to make sure they were consolidated either in one place or in isolation rooms.
When it first hit me was when we received the patient, she was demanding oxygen. I can't breathe, I can't breathe, and she just snatched the oxygen from me.
And then it was like a tsunami. It just totally took over. People were just desperately trying to save lives, desperately trying to keep patients going. For us at St. Joe's, you know, we serve our community, and our community is the type of community that was hit hard. I just think that we have to be open to looking outside of what the structure and the framework has been traditionally in this country, because it's not working. And COVID just amplified where it doesn't work. There has to be better solutions.
All our rooms were filled, and that was when we converted the whole waiting room into a treatment space. I remembered how it is to work in a provincial hospital. Back home, patients would be everywhere, and it would be in a basketball court. So I used that as a form of guidance for me.
I've been a nurse for 30 years, but I've never had like 5 patients die on the same day. I cried many days. I cried many days because their families weren't there. So I knew how the family would feel.
What I want the families to know more than anything is that their loved one wasn't alone, that I sat with them and held their hand, and we were caring for them, and we were present. All of us were. And so I hope family members can take some comfort in that, knowing that the people they were loved were never alone, that we were there for them. At the end of the day, I have to remind myself, be present, be here, be now. Particularly when that question always comes back, Mom, what happened at work today? What'd you do? And this, I'm not talking to them about. They know what we're dealing with, but I try to shelter them a little bit because it's, I don't want them to know how bad it's been. I don't want them to know. You know, you can't explain to your kid what it's like to see somebody die or to see somebody so distressed or in agony. And, you know, to hold somebody's hand as their heart stops beating is a very hard thing to describe to anybody else. It is a very, very strange time. A lot of questions, a lot of uncertainty, because every week is a new story that we're trying to unfold. Right now, we feel like we've got a cliffhanger because we don't know what the next phase is going to bring.